So someone asked in the comments when you should get a carotid ultrasound. So basically a carotid ultrasound is an ultrasound test of the neck arteries, and basically it's looking for blockages in the arteries of the neck or any other types of changes. And you can get blockages in any artery of your body. And so the main issue is that if you get cholesterol blockages here, if it's severe, then you may not get good enough blood flow to your brain, and that puts you at increased risk of stroke. Sometimes the cholesterol plaques can break off and that can cause a stroke, and so that's why someone would want to know, they would want to get a carotid ultrasound to look at blockages in the arteries of the neck. And so usually the reasons that people get it is one, you already have had a stroke or a mini stroke and you have that diagnosis newly, and then usually a carotid ultrasound is ordered. The second reason is that, usually strokes will show up on brain imaging, but sometimes if you have a mini stroke or a TIA, that doesn't show up on brain imaging. But if your symptoms are concerning for that, and that would be something like transient loss of speech or vision, or transient loss of, let's say, movement of half of your face or an arm or a leg or hand or foot, just transient loss of movement in some part of your body, that could be concerning that you had a TIA. And that's another reason that people would get a carotid ultrasound, to see if there's any blockages there. And then the third reason is that, if you have two or more risk factors for carotid blockages or blockages in the arteries in general, and that's like high cholesterol, diabetes, high blood pressure, and smoking are the most common ones, then you may get, carotid ultrasound. And if you have those risk factors, and even if you have less, traditional symptoms like dizziness or lightheadedness, a lot of things can cause dizziness or lightheadedness. But if you have those symptoms and you have some risk factors for cholesterol blockages, then that may be a reason for you to get a carotid ultrasound. Discuss it with your doctor, to see if there are blockages in the arteries of the neck that are leading to not enough blood flow getting to the brain, and that could be responsible for your symptoms. And so those are the three main reasons that you may get a carotid ultrasound.